I want to wish everyone a good evening. I am Marko Djurdjevic, a representative of the pharmaceutical company AlivitPharm, whose headquarters are in Herzegovina in a place called Lubin. Let's say that AlivitPharm, using the knowledge of domestic and foreign experts, and more than 7 years researching the potential of the synergistic effect of fermented garlic and medicinal plant extracts, formulated and produced a line of preparations which provide a comprehensive service in the prevention and treatment of various health conditions. Let me say, we are the only pharmaceutical company among these space that packs its active ingredients in soft gelatin capsules and thus enables high bioavailability of its preparations. We have to mention that in the world fermented garlic is known by the name black garlic, which name we also accepted because it is our global market. We are currently present in more than 10 different countries in the world, and the results so far in the application of our preparations are more than positive, as evidenced by numerous biochemical results of our users. Today, Professor Branislava Ivanovic and Master Tatiana Milosevic will share her knowledge in a lecture entitled, Fermented Garlic and the Protection of Cardiovascular Health. Thank you once again.
Dear listeners, as Marko announced, tonight's webinar is dedicated to fermented garlic and the protection of cardiovascular health, and I will provide some evidence on the significance of garlic in the prevention of cardiovascular diseases, both primary and secondary. At the very beginning, I would like to remind you that eating habits are one of the key factors, if not the key factor, in the development of cardiovascular diseases. That's why, approximately 4 decades ago, healthy eating pyramids were formed, with the base being the consumption of fruits and vegetables, and at the very top, the things we love most, processed meats, red meat, and, of course, other types of meat. One of these pyramids, among many others that focus on different aspects of health, also dealt with stopping and preventing inflammation. This is not only about improving immunity, but also about reducing chronic low-grade inflammation, which is responsible for atherosclerosis, among other things. A significant component of that pyramid included the use of spices. Normally, when we think of spices, we think of something added to food for better taste, smell, or even color. However, many spices, due to alkaloids, tannins, vitamins, phenols, polyphenol, and sulfur compounds, play a role in improving health. One such spice, some may argue it's not a spice, is garlic. Garlic is not a vegetable, we classify it as a spice, and its use has increased 7-fold from 1970 to 2005. It is now clearly the most widely used spice. Why? Because over the last 4 decades, much has been discovered about garlic, and its health benefits date back to the Chinese. The Chinese used garlic as a yang component to improve health, particularly in treating depression. The Sumerians used it for various diseases, and Talmudic writings point to its use for improving appetite. The ancient Greeks used garlic before going into battle and the Olympics, though those who consumed it were not allowed to enter the temples, as we all know. Hippocrates mentioned it as a possible remedy for intestinal parasites. The Romans used it for snake bites, spider bites, and insect stings. When it was brought to Great Britain, it was grown in monastic and church courtyards, and added to tea with honey. It is important to note that Louis Pasteur recognized it as a bactericidal agent, and it was also used to treat cholera, typhus, and diphtheria, while Leclerc used it in the prevention of the flu during World War I. So, this is not a new story about the health benefits of garlic. However, the last 4 decades have brought new research, allowing us to identify which components contribute to the benefits of garlic. These include 33 sulfur. Components: numerous enzymes, copper, potassium, magnesium, selenium, zinc, vitamins A, C, and B group, 17 amino acids, and what is of particular interest to us tonight, allicin. It plays a role in reducing the risk of atherosclerosis. I already mentioned that Greek marathon runners and warriors weren't allowed to enter temples if they consumed garlic, due to the unpleasant smell. For decades, efforts have been made to use the beneficial components of garlic, leading to the creation of garlic essential oil, garlic powder, oil macerates, and now, we will talk about fermented garlic or black garlic. All forms of garlic, including natural garlic and its preparations, are well absorbed from the digestive tract, where allicin is produced from alliin. Through portal circulation, allicin reaches the liver and enters the bloodstream, where it exerts its positive effects. These positive effects are on various systems, but tonight we will focus on how garlic affects certain metabolic disorders, blood pressure, oxidative stress, and overall cardiovascular diseases. Generally, when we think of garlic, we think of hypertension. However, garlic's benefits are most prominent in lipid regulation. Garlic reduces lipid absorption in the digestive tract. Additionally, like statins, it affects HMG-CoA reductase, lowering cholesterol levels in circulation, increasing the number of receptors on hepatocytes, and thus reducing LDL cholesterol levels. One of garlic's components, TLR, also directly affects the synthesis of cholesterol in hepatocytes. What's important is that numerous studies have proven these effects. A major meta-analysis clearly showed that garlic, whether natural or as a preparation, leads to a reduction in total cholesterol over about 8 weeks, regardless of baseline cholesterol levels. What's even more important for us, garlic preparations have been shown to reduce LDL levels, increase HDL, and decrease triglycerides in this study. A newer meta-analysis, albeit with fewer studies, confirmed that garlic reduces total cholesterol, lowers LDL, improves HDL, and has no effect on triglyceride levels. There is some disagreement about how garlic affects hypertriglyceridemia. It is possible, though no study has been done, that certain forms of garlic may have a better or worse effect on triglyceride levels. In any case, analyzing 8 meta-analyses on garlic's effects on lowering total cholesterol and LDL, only one did not show a positive effect. In all others, garlic led to a reduction in total cholesterol by 10.8 mg per dl, to 17.3 mg per dl, about 0.5 mol/L, or 10 mg per dl of LDL. I've already mentioned that when we think of garlic, we think of reducing blood pressure. It is well known that blood pressure levels are a result of the balanced action of the potent endogenous vasoconstrictor angiotensin II and the potent vasodilator nitric oxide. Garlic, thanks to its sulfur components, increases the bioavailability of nitric oxide, which lowers blood pressure. This has been clearly proven. Garlic reduces both systolic and diastolic blood pressure. Participants were divided into those with normal blood pressure and those with elevated blood pressure, and garlic had an effect only in hypertensive patients. Thus, garlic preparations can be given to hypotensive individuals to lower, for example, LDL levels. Once again, a meta-analysis has shown that garlic preparations reduce systolic blood pressure by 8.3 plus or minus 1.9 mmHg and diastolic by 5.5 millimeters of mercury, which corresponds to monotherapy. These garlic preparations have led to a reduction in cardiovascular risk by 16% to 40%. According to the results of this meta-analysis. A further analysis of all these meta-analyses has shown that garlic acts as monotherapy in reducing blood pressure levels. Additionally, we see benefits in diabetes. Garlic lowers blood glucose and hemoglobin A1C levels and reduces some complications of diabetes, such as diabetic retinopathy. Essentially, garlic and its components act directly on pancreatic cells, reducing oxidative stress and the pathological changes associated with diabetes. A nice meta-analysis focused on the effect of garlic on lipid levels in diabetics, but it also showed that garlic lowers blood glucose and hemoglobin A1C levels. Again, there are controversial data when it comes to obesity. You will see from my talk about fermented garlic, or black garlic, that it significantly impacts fat tissue. However, this meta-analysis shows that garlic does not affect body weight or body mass index, only waist circumference. But we know that this is a serious parameter and indicator of obesity. This new meta-analysis from the beginning of the year clearly showed that garlic improves the condition of patients with metabolic syndrome, acting directly on blood pressure, HDL levels, and obesity. Therefore, we have a solid reason to include it, especially since we know it has anti-inflammatory potential. But before discussing the anti-inflammatory potential of garlic, I would just like to mention another, in my opinion, the most important benefit in the prevention of atherosclerosis. Garlic increases the activity of superoxide dismutase, catalase, and glutathione peroxidase, which reduces free radical levels, a primary factor in the development of atherosclerosis, and reduces LDL oxidation. Another meta-analysis showed that garlic improves overall antioxidant capacity and reduces one parameter of oxidative stress, malondialdehyde. Unfortunately, we are a country genetically predisposed to increased homocysteine levels, which is one of the unconventional factors in the development of atherosclerosis, and garlic helps improve endothelial function, leading to vasodilation in cases of hyperhomocysteinemia. The antiplatelet effect is very important. It can present a problem for patients on anticoagulant and antiplatelet therapy, but it is clear that garlic, acting on thromboxane A2, a potent vasoconstrictor and activator of platelet aggregation, reduces platelet aggregation. This is a very detailed slide, and I won't even try to explain it. I just want to point out that it clearly shows garlic's effects on lipid status, oxidative stress, inflammation, angiogenesis, and myocardial cell apoptosis as the final product. This is another of many review studies showing that allicin, saponins, and phenols lead to various chemical reactions that reduce oxidative stress and the risk of atherosclerosis. It's not for nothing that we titled this talk with the fact that garlic plays a role in protecting cardiovascular health through its effects on risk factors, antioxidant and anti-inflammatory actions. Again, I return to the serious problem of the unpleasant odor garlic causes, and secondly, more than 2 cloves of garlic can cause certain gastrointestinal problems, particularly reflux and esophagitis. This is why it is important to create an optimal product containing all the good components of garlic, and it seems that this has been achieved. Today, we have fermented garlic, which is made by exposing the native Herzegovinian garlic variety to high temperatures and humidity in special fermenters for 90 days. It is no longer just garlic, it is now black garlic, which significantly increases the activity of polyphenol, flavonoids by September 3rd and January 5th times, and increases the concentration of S-L-L-cysteine by 4 to 6 times compared to regular garlic that we buy at markets or supermarkets. In any case, black garlic is processed garlic in which active components have significantly increased, contributing to the prevention of atherosclerosis. I mentioned that certain forms of garlic may affect obesity, but not all. We now have a study comparing fermented garlic with simvastatin. The effect on lipid components was almost the same, but it predominantly affected fat tissue, i.e., obesity. It has been clearly shown that fermented garlic reduces fat tissue synthesis and increases fat tissue breakdown, which is a clear benefit, especially when combined with physical activity. Another study in an animal model not only showed balanced effects on lipid components, but also reduced renal and epididymal fat, which was measured in the animal model. There are many references supporting the use of fermented garlic in regulating total cholesterol, LDL levels, and now we are talking about HDL and triglycerides.
Thank you, Professor, for this truly phenomenal introduction. I really enjoyed every sentence you said. Now let's see when supplementation with products based on fermented garlic is justified and when it is safe. Let's see who should be given it in everyday practice, whether in a doctor's office or a pharmacy. The first product we want to present from this line is Cardio Plus. To be completely sure in our practice, who should we recommend it to and who should we not? We will answer the questions listed here. Who should receive it, who should not, how long, and in what dose? So let's go step by step. Everything the professor said, I would like to emphasize that we are talking about fermented garlic here, as the professor was also presenting facts regarding conventional garlic formulations as well as fermented garlic. So these are products containing fermented garlic, which has, as you saw, a strong antioxidant effect, protects myocardial cells, and as we started with, works on total cholesterol, LDL cholesterol, HDL cholesterol, and affects homocysteine levels, which are now being talked about more and more, i.e., it lowers its concentration. When we talk about hawthorn, you heard that it improves blood circulation to the heart muscle, enhances the strength of heart contractions, and helps normalize heart rhythm. These two components are also found in these categories as listed here, and mistletoe, which is something new we've heard about, has a cardioprotective effect and is recommended for lowering blood pressure and in the prevention of atherosclerosis. When and to whom should it be given? That is, hypercholesterolemia, forms of heart failure, hypertension. What we will ask the professor, and we can already hint at a positive answer, is that these products can be used in prevention. We will see in which patients, but certainly in those with an increased cardiovascular risk. When we talk about how much, the recommended dosage is 3 times 2 soft gelatin capsules. It should always be taken with or after a meal, with a full glass of water. To be sure we are giving our patients safe supplementation, the doses should not be exceeded. These are not products that should be given to pregnant women, breastfeeding women, or individuals under 18 years of age. They should not be used by people who are hypersensitive to the components of this product. We will discuss whether there are any interactions where we need to be cautious, and whether it is necessary to take a break after certain cycles of using these products. Let's start with contraindications. Here, we have listed contraindications for conventional garlic, i.e., garlic that we have used earlier. Since we still cannot definitively determine the contraindications of fermented garlic, because there are not enough studies, we can say that fermented garlic is safer than conventional garlic. What is a contraindication, however, is its use with antivirals. This is very rare, as these are HIV and hepatitis C drugs, so these are patients that are relatively rare in pharmacies and doctors' offices. Other contraindications are limited to hypersensitivity to the ingredients of the product. But to ensure we don't do anything that could harm the patient, we need to know what the limitations are in using it. So we are no longer talking about contraindications but about precautions. For fresh garlic, interactions with anti-aggregating drugs, including aspirin, which is an integral part of secondary prevention, have been described, and we may discuss this with the professor. It should not be used with oral anticoagulants or antiviral drugs. Another thing to keep in mind, whether it's a minor or major surgical intervention, or tooth extraction, these products should be discontinued 7 days before any planned intervention. In addition to garlic, this product contains hawthorn and mistletoe. When it comes to hawthorn and mistletoe, there are no contraindications. However, we do need to take precautions. They should not be given to pregnant women or breastfeeding mothers. Regarding hawthorn, I would highlight interactions with cardiac glycosides and beta blockers, as hawthorn affects both. Cardiac glycosides have a narrow therapeutic range, so we should be cautious there. As for mistletoe, again, it interacts with cardiac glycosides, and we might also highlight drugs with immunomodulatory properties, as mistletoe is often used in studies and practice to boost the immune system. That is how it ended up on the market. We promised we would say who should and should not take it. Yes, hypercholesterolemia, hypertension, heart failure, and prevention. No, MAO inhibitors, cardiac glycosides, beta blockers, anticoagulants, and anti-aggregating drugs, immunomodulators. So for these medications, caution is needed. We cannot say strictly no, but antivirals are the drugs with which garlic-based products should not be used. If your patients are using any of these drugs, that should be monitored. With varying degrees of risk, guide patients through therapy with garlic-based products. The second product is Aterostop, and again, we need to answer the same questions. Who should it be given to? Who should not? How long? And in what dose? So let's see what it contains. The first two components are exactly the same as the first product, and they are fermented garlic and white and red hawthorn. The third component of Aterostop is lemon balm, which, in addition to having a calming and sedative effect, also has positive effects on heart function and a cardioprotective effect. This is something the professor mentioned. So, this is a product that, due to its first two components, lowers blood pressure, reduces elevated fat levels in the body, and prevents the development of atherosclerosis. The dosage is 3 times 1 capsule, during or after meals, and it should be taken with a full glass of water. There is no difference in these rules that need to be followed to ensure safe supplementation. Therefore, the daily dose should not be exceeded. It is not intended for people under 18 years old. We need to pay attention to the therapy the patient is already on, and it is recommended to take a break after 3 to 4 months. The only difference from the previous product is lemon balm, which has no contraindications for use. So we only have hypersensitivity to the active ingredients of this plant. When it comes to wild garlic, everything that applies to garlic applies to wild garlic as well. Simply put, due to the lack of data, it is not used during pregnancy and breastfeeding. However, it is believed that there are no contraindications. Lemon balm should also not be used during pregnancy and breastfeeding. Another thing to keep in mind is that lemon balm can cause drowsiness, and it is not recommended to use products containing lemon balm while operating motor vehicles or machinery. This could be the only precaution when using this product. There are questions to which I can provide answers, and I've listed them on this slide. For the next 2 slides, we will ask for the professor's help. When we talk about when to take it, we said during or immediately after meals. As for how long to take it to achieve the full effect, the recommendation is 3 to 4 months continuously. When talking about the best time of day to take it, it is best to tie it to the 3 main meals since both products are used 3 times a day. For example, right after breakfast, right after lunch, and right after dinner. Can both products be used at the same time? No, they cannot. Can the products be overdosed? Yes, they can, so it is essential to follow the manufacturer's instructions for both. Do they interact with alcohol, and can they be taken with alcoholic beverages? It is recommended not to do so, as there is a special caution with patients who have liver damage, and people who consume larger amounts of alcohol are at risk of liver damage. When might the first signs of improvement be felt, and when could laboratory tests be done to see if the effect exists? This could be after 1 month of use. The dilemma we need the professor's help with is the question of who should receive which of the 2 products I have presented to you. On one hand, we have Cardio Plus, and on the other hand, Aterostop. Now, based on everything we have discussed and since the dosages of these ingredients differ in both products in practice, whether in a doctor's office or a pharmacy, which product should be given to which patient, Professor?
There is a clear difference in the dosages of fermented garlic between the 2 products, and it is expected that the effect would be more pronounced with a higher dose. In this direction, we can conclude that Cardio Plus, with its higher dose, not only of fermented garlic, but also of hawthorn extract, is more suitable for patients with significantly elevated lipid levels, hypertension, early-stage diabetes, or those with metabolic syndrome. On the other hand, the second product, with a smaller dose of fermented garlic and hawthorn, would be more appropriate for patients with a family history of these conditions, but no significant risk factors, those who are simply concerned about their health. For these patients, the atherosclerotic process is likely not driven by direct risk factors, but rather by other components that trigger oxidative stress and inflammation. For patients with more pronounced risk factors, these products could still be beneficial. However, when it comes to hypertension, even though garlic supplements work as a monotherapy, these products, according to the new nomenclature, would be suitable for patients with elevated blood pressure values. Hypertension is no longer viewed merely as high blood pressure, but rather in terms of normal and elevated levels. Now, elevated values between 120 and 139 millimeters of mercury, when risk factors are present, are treated. In these situations, alongside lifestyle adjustments, this would be an ideal product. For patients with mild increases in LDL levels who are not ready to take statins, this product would be excellent. For those on antihypertensive medications or histamine therapy, or any other drug combinations, this could serve as complementary therapy, helping to reach the target values that are crucial in reducing cardiovascular risk. Therefore, these products have a place both in primary and secondary prevention. In primary prevention, they can be used alone, while in secondary prevention, they should always be used alongside other therapies.
Prof. Sorka, thank you so much. I believe this is the key to what we need in practice. Since we've talked about acetylsalicylic acid and the precautions that are essentially always part of patient therapy when secondary prevention is involved, how should we follow up with these patients, and what precautions should be in place in practice?
When we talk specifically about acetylsalicylic acid and secondary prevention, when a patient transitions from dual antiplatelet therapy with P2Y12 inhibitors, we can continue with the use of fermented garlic supplements without much concern. However, in patients who are on dual antiplatelet therapy or are taking oral anticoagulants, I would never recommend, especially not Cardio Plus. For those taking oral anticoagulant therapy and are unsure whether they can achieve the required INR levels, but also have atherosclerotic cardiovascular disease, Aterostop could be used with caution, along with constant INR monitoring.
Well, that's always a very interesting question, and it's very present in practice. Thank you for your answer. And now, to wrap up, there were a few dilemmas I came across while preparing the lecture, which really made me wonder about what should be done in practice. We've answered some, but some are still unanswered. So, when it comes to the preventive use of garlic-based supplements, you've basically covered everything that interests us. We've more or less answered the second question: whether these supplements have their place when there are small deviations from the reference values. And what is also a dilemma for daily practice is whether the cycles of using fermented garlic-based supplements should be repeated, and how often. In addition, I would add the question of how long the break between two cycles should be.
I must point out that the experiences with garlic-based supplements are not extensive, despite the fact that they have been researched for so long. Especially when it comes to fermented garlic, and what is important is that there is a limitation on taking it continuously for 3 months. At that point, we can clearly assume whether we've had a benefit and what the benefit of using the supplement is with a 2-week break. Continuity with these breaks is necessary, because risk factors are definitely not something that is treated like tonsillitis, it's something that burdens us for life. So this is also a lifelong therapy, just with short breaks, and time will tell whether these breaks are even necessary. Overall, it's important to supplement the experience with the use of these supplements, and then we will be able to speak more after years of experience.
What is also interesting is that we cannot ignore the pharmacoeconomic aspect in our everyday work, and we need to help our patients get what they can afford. Is there a maintenance dose? Especially when we talk about the Cardio Plus supplement, which is dosed 3 times with 2 capsules. Especially in these patients to whom we introduce it preventively, do you think that taking 1 capsule 3 times a day has any effect, or do you think it only serves its purpose in the full dose?
I would still stick to the evidence that tells us that it is necessary to take 2 capsules 3 times a day, because, in this way, we achieve the desired effect. Why? Because no risk factor can be cured. When we lower the level of LDL with a specific medication, there is no maintenance dose for that, we go with the dose that reduced it. So, we can assume that a maintenance dose is not possible, and we should not insist on that, but continue with what has already done the job.
All right, these were the dilemmas I encountered while preparing the lecture. Now let's try to resolve the dilemmas that our listeners came up with while following this lecture. The first question is whether garlic helps with weight loss. We said it affects visceral fat and waist circumference, but does it have any impact on weight?
No, but that is individual. It is important to note that obese people not only have obesity but often also associated risk factors, so in this context, it is necessary to try garlic-based supplements, which might lead to weight loss in some individuals. We have clear evidence from animal models that fermented garlic reduces both the synthesis and increases the breakdown of fat tissue, but we do not have clear evidence of how it affects body weight in humans. So, for these individuals, it is important to treat other risk factors, such as increased blood glucose, increased blood pressure, and high triglycerides. Reducing inflammation is the essence of this supplement. It is most commonly seen in patients with metabolic syndrome, and obesity is an incubator for hypertension and all other risk factors.
There's a question here that nicely ties into the whole story. A listener asks if garlic supplements can be used with red yeast rice, which is used for elevated fats. It seems to me that we don't have any dilemma here.
We don't have a dilemma. These are two ways to reduce LDL levels. Red yeast rice is just a natural statin, so they can be used together, especially if patients don't want to take statins for reasons unknown to me.
This is something that is very common in everyday practice, probably both in the office and in pharmacies. Since Marco is back after some technical issues, would you like to continue with the questions, Marco?
Here we have a nice case from practice, where a colleague says that she already has a few patients from the pharmacy who have used Aderostop, and the biochemical results show that it quickly regulates LDL and HDL levels. So, I see a question here regarding the registration status of the product. Is it a herbal medicine, a traditional herbal medicine, or a dietary supplement?
It is a dietary supplement.
Yes, our products are currently registered as dietary supplements. However, in the near future, since the raw materials from which they are made are standardized, we plan to elevate this to a higher level, and we plan to invest in clinical studies that would raise our products to a higher standard. We plan to conduct clinical studies for 5 products, and we would like, as soon as the results of the analysis allow, to achieve the status of a medical supplement.
Professor, we have a question from Maria, asking if a person with angina pectoris, but without hyperlipidemia, has any reason to use this supplement.
In people with angina pectoris, due to the petroplenic effects, we must introduce statins, and alongside them, it is justified to introduce garlic-based supplements because of their additional anti-inflammatory and antioxidant effects, independent of their effects on lipids. So, when we talk about garlic-based supplements, it is tangible and measurable that they work on LDL levels and blood pressure, but what lies behind that is even more significant. The anti-inflammatory and antioxidant effects are what makes sense to introduce these supplements in all patients with any form of atherosclerotic cardiovascular disease.
I must say that in our portfolio, we have a product specifically designed for this, though it's not part of tonight's portfolio. The product is called Hepatocari, and it has a protective hepatoregenerative effect. It is specifically intended to be used alongside statin therapy as an adjunctive therapy because it lowers liver enzymes.
Okay, now we have a question about how it affects potency.
Marco will mention other preparations that have a greater impact on that issue, but these two act directly on the vascular system. There are garlic-based preparations that are more commonly used for that purpose, and we have much more experience with them in our region because more attention is given to that than to atherosclerosis.
You can see that obesity is something we started with, and we're ending with effects on potency. So the problems are ranked according to what is most thought about. We must think about something that quietly kills. This webinar is dedicated to something that doesn't cause pain, but certainly affects lifespan. Marco, go ahead.
Well, we have a product called Potent Max, which is directly intended for the issue the gentleman asked about. This product contains a plant called Tribulus terrestris, which is the first registered Tribulus terrestris on our market. It directly affects testosterone synthesis, meaning it's not a replacement therapy, but rather enhances the synthesis of your own testosterone, thereby increasing energy, boosting libido, and reducing and preventing erectile dysfunction. It increases the concentration of spermatozoa and the number of motile spermatozoa. I could speak from my own experience. I'm currently undergoing in vitro fertilization, and I have biochemical analysis results that show incredible results after a month and a half of using this product. Even the sperm concentration is 3 times higher than the initial biochemical findings. So that would be the answer to the question.
I think the question here was more directed at the fear of statins, so whether this could be an alternative, because anyone who comes with a prescription for statins asks how it will affect them.
Understood.
All right, we are nearing the end. Does Marco have any more questions for the professor? Her presence should be used as best as possible.
Let's ask the professor about her experience with patients who have been introduced to therapy and what kind of feedback she has received from patients who are using our products.
Unfortunately, I don't have patients to whom I would prescribe this for primary prevention. My patients are a bit more complex. They are mostly patients with artificial valves, anticoagulant therapy, but regardless, this small number of patients who come to me because of family history, there is a reduction in total cholesterol and LDL. It's not a spectacular reduction, but a decrease of 0.3 to 0.5 mol per liter of LDL can certainly contribute to the protection of blood vessels. So, in the future, I will probably have more patients to whom I will be able to prescribe these products.
Well, we've only been on the market for about half a year, so biochemical results will become more numerous over time.
We have just one more question that was asked earlier, and I think the answer has already been given. One girl asks if people who only have an increased lipid status can use these products. The answer is absolutely yes,
that's correct.
Right. Here we have compliments and another question. What caution should be taken with beta blockers, considering that many hypertensive patients use beta blockers?
That's an interaction. Hawthorne increases the strength of heart contraction, while beta blockers work oppositely. So, it can reduce the effect of beta blockers. Therefore, for hypertensive patients who do not use beta blockers, it is absolutely indicated to give these products. Hawthorne is the one that increases the strength of heart contraction.
And we have one more question related to antiarrhythmic drugs.
There is another mechanism of action, so there will be no summation of effects between antiarrhythmics and Hawthorne in the preparation. Also, the dose is not high enough to interfere with the action of antiarrhythmics in any way.
We have answered all the questions. Marco.
I would like to thank all the participants of this lecture on behalf of our pharmaceutical company AlivitPharm. Thank you once again.
Thank you, goodbye.
Goodbye.